To women out there, and I know Terence is going to be completely silent. Besides saris, this is the other thing that gets him silent. We talk about fibroids.
Not for the same reason, though. It's a completely different situation.
Ah, yes, that is.
I mean, men tend to go silent with their own problems and also with the
women's problems. Okay, now you wonder why, actually, because the men have to contribute.
Yeah, we do.
You know, we're going to jump into this topic on fibroids, basically.
With someone who's been contributing.
Yes, we have the doctor in the studios. But before that, of course, Malaysia, our lines are going to be open again. 22829062, 22823043. We'd love it if you can give us a call, talk to us. If there is a question for the women out there, you want to ask a question about this particular topic, just have a quick chat with the doctor. We've got Dr. Kannapan Palanipan, who's from the HKL Obstetric and Gynecology Department, to tell us more about fibroids. Good morning, doctor.
Very good morning.
All right, doctor, let's start off with the simple stuff. The definition. Sure. What are fibroids?
Okay, fibroids are basically growth of the uterine wall. So it's basically thickening of the muscle, of the smooth muscle. And it is very benign. That means it's not a cancerous growth.
Okay.
And it's pretty common, actually, among women.
Okay.
So if you have 3 women above the age of 30, one would tend to have a fibroid.
All right.
And when we talk about women, does it cut across, what do you call it, any particular race, or is it open to all women from all ages?
Well, if you look at the Asian community per se, I don't think there are enough studies to show any specific ethnic group having a higher rate of fibroids. But if you look at the world population per se, they do see it more common among Negroes.
Oh, I see.
So in the US, they have documented that compared to the whites, the Negroes tend to have more higher incidence of fibroids.
What does this mean? If it's benign, what do fibroids really mean? I mean, why are we even discussing about it?
Oh, that's right. Now,
typical question coming in from a guy, right?
When you say benign, that's good. That's good because it's not cancer.
Right.
Okay, that's very important. But fibroids, when of a particular size, of a particular location, tend to have issues. So sometimes if the fibroid is sitting inside the cavity, then it tends to impair with fertility. Sometimes fibroids also sitting inside the cavity tend to cause heavy bleed during menses, and some women have severe cramps due to that. Then again, fibroids can grow into a huge big mass. I've taken up fibroids quite large. When I was in Muar, the biggest fibroid I took out was 14 kilo.
What? 14 kilogram fibroid.
That's right.
See,
I cannot imagine
now
that.
you know why we need to talk about these things.
Wow.
See that?
So
that's the reason we need to talk about it.
During the surgery, it took us some time. I actually had to have 2 doctors to carry the mass up as I was able to resect it away. The patient recovered very well, you know, and she was very grateful, because before that she was like pregnant 6 to 8 months.
Right.
And after that, she had lost 14 kilos.
Oh, wow.
How large was the patient in terms of?
Oh, the patient actually was a small-sized lady.
With a 14 kilogram?
That's right. She was very shy.
Wow.
She was from the outskirts of Muar, and a lot of people had encouraged her, had advised her actually to go, but then she just took some traditional medicine, you know, and she didn't have any other symptoms except this feeling of a mass. Finally, she decided to come, and after a long discussion, she agreed for the surgery.
Okay, that's really scary. That's a scary story, doctor.
See?
I mean,
now you know.
Yes, now I know. It is really scary. How different are fibroids from a condition called endometriosis?
Okay. Now, fibroid and endometriosis tend to occur together because the source basically is estrogen hormones.
Right.
So as long as a lady is in the reproductive age, that means she's having regular menses, okay, the estrogen production is continuous, and that tends to stimulate fibroids. At the same time, it tends to stimulate this problem called endometriosis.
Right.
Now, endometriosis, to make it short, is basically similar tissue as what it is inside the womb, but it is found outside. That means it could be found at the ovaries, tubes, behind the uterus, where it is not supposed to be. And when they have bleeding here, then they tend to have bleeding at that location also.
Okay.
And that causes pain.
All right. So what we're seeing on screen right now, doctor, maybe you can give us a quick explanation.
Now, what we are seeing in the screen is basically an ultrasound. An ultrasound is a scan which is done over the skin of the abdomen, and this is what we tend to see in a normal uterus.
Right.
So you can see this is perfectly normal uterus, and you can see the lining inside the cavity of the womb. Now, this next picture, this is what is fibroids all about.
Right.
So here you can see fibroids can be on the outer wall, what is called as subserosal. It could be in the wall, which is pretty common. It's called intramural, and sometimes it can be inside the cavity of the womb. Now, these are the ones that cause quite a lot of problems. I told you, like bleeding, fertility issues, and these are what we call as submucosal fibroids.
Okay. Now, I think a lot of women, two prongs to this. One, they're not aware that they have fibroids, and they may have massive cramps, menses cramps. Two, if they are aware, they don't think that it's really important to do anything about it. They probably think, yeah, you know what, I drink a lot of pineapple juice and it just goes away, or something to that effect. I don't know. I mean, I think women have that problem. So what are the symptoms that we need to look out for, or women need to look out for in terms of fibroids itself?
Okay. Now, fibroids in majority of patients, because I told you it's pretty common. It's among 1/3 of women. Majority of patients do not have symptoms. And this is where the fibroids are actually very small. They can be 2 centimeters, 3 centimeters. And it's coincidentally found out during a normal routine gynae examination, when they do an ultrasound and they tell you that there's a fibroid. Now, if the lady is experiencing problems, especially cramps are getting worse, periods are getting heavier, yes, definitely she needs to see someone and get an advice. Because if the lesion is inside the cavity, then we could easily remove it, and settle the issue. All right, so there are treatments available.
All right, doctor, we got a question from our producer who's asked, is this hereditary?
It is not really related to genetic issues, but it tends to happen more common among certain, if there are family members having fibroids, we tend to see it a bit more common. But to say that it is genetically linked, it's a bit difficult to comment on that. Because until now, we have not really identified a particular gene that is related to fibroids. That's right.
Is it also caused by lifestyle? Would lifestyle contribute to this?
If you're looking at lifestyle in the sense of delaying pregnancy, due to career commitments, yes, it can have an effect. Because as I told you, as long as a lady is having menses, the tendency, there's a higher risk of getting fibroids. So if she has children at a younger age, then compared to women who wait for, let's say, after the age of 35 or so, that means they have been exposed to a longer duration of estrogen. So the risk of fibroid does go up.
I see. Now, in your cases, doctor, I'm quite sure you've seen a lot of cases come and walk through your doors. What are the more prevalent ones that come in? And do you see them on a particular age group that's coming in?
Because basically I treat fertility patients with fertility issues, and I do a lot of IVF. So what happens is patients who are coming to us are basically for fertility problems, and we pick up all these issues. If in a patient who is a bit more mature, that means who is 40 and above, the problems are more related to menstrual problems. That means the menses used to be a bit more heavier, and that is how we tend to pick up the issue of fibroids. As I said, in most circumstances, women do not realize that they have fibroids.
Now, there are some women who say, yes, I've seen a gynae. The gynae said I've had fibroids, but my fibroids are too small for me to remove. They're too tiny to even touch and remove. So for women like this, what can they do? They suffer the pain every month. Yet, they would have seen a gynae, and the gynae would have said, look, I can't touch your fibroids right now. It's just too tiny. Let it grow a little bigger. So how long, does it take for this fibroid to grow? And in between, what can the woman do? All right.
Now, as I said, fibroids are pretty common, and they can actually be coincidental. That means here we are looking at possibility of issue of endometriosis, because endometriosis is the one that tends to cause quite severe pain and dysmenorrhea, even pain in between cycles, etc. So the fibroid may just be a coincidental finding because endometriosis cannot be diagnosed by ultrasound unless there is a collection of blood, cyst, what we call as a chocolate cyst, then we attribute it to endometriosis. If we don't see the cyst, then it is very difficult to comment on endometriosis unless we do a laparoscopy.
Right.
What are the chances of a woman carrying a fibroid through well into her menopause age? And since you mentioned estrogen being a factor, there are drugs that can actually limit estrogen or perhaps induce menopause. So will drugs like this help when it comes to treating fibroids?
Wonderful question.
See, I knew he had questions.
It was brewing.
Are you serious? It was brewing, yeah?
It's a great
For
question.
someone who said he's not going to ask me any questions, right? Yes.
It's a great question. Well, yes, you are right, because it's estrogen related. And once the lady is menopause, all right, the fibroid tends to shrink. But if the fibroid is huge, because example, of a size of a patient who is 4 months or 5 months pregnant, then the fibroid takes time to shrink. So sometimes it takes 5 years, 10 years to shrink. So whenever we see a lady who is menopause and she's asymptomatic, that means she's got no pain, no other issues, and there's a fibroid, we usually treat them conservatively. Now, whether there are medications that can control estrogen, yes, there are medications that can control estrogen. One of the commonest thing is the family planning pill, right? What it does is that it gives a protective effect, but it's not a treatment option. It gives a protective effect. So that means if a lady is on contraception, or it's just like being pregnant, or even in the breastfeeding phase, the estrogen levels are low, therefore the fibroid tends not to grow. Okay, but it's not a treatment option. Treatment option in medication is quite limited, and most of them do have side effects, and the duration is that it can be used is actually very short. One of it is that we use monthly injections up to 6 months, but all of this is very temporary. Once you stop the medication, it grows back again.
It comes back again.
So if it is an issue, we would rather do it in a more what do you call the invasive methods. That means it could be either surgery, etc. So treatment options are all very temporary measures.
I see.
And what are the chances of recurrence?
Okay, fibroids can always come back, as long as the lady is menstruating.
Right.
Okay. Now, even during a surgery, we tend to remove the big fibroids. Sometimes we have removed 20 fibroids, 30 fibroids, and you still see there are some more fibroids left. So all the small ones tend to grow, but they grow in a very slow phase. So we tend not to remove all the small ones because for surgical reasons, the complications can be high, and also because of fertility, we would rather prefer her to conceive.
Probably, hopefully after the conception, then it just moves off.
With the conception, it is protective. That means the fibroid doesn't grow during that phase, and hopefully she can complete a family before the issues crop up again.
Well, doctor, before we let you off, your advice to women out there who are possibly watching this show, in terms of getting awareness on this matter, and what can they do?
Now, for all women, we actually encourage them to go for annual checkup.
Right.
Whether men or women, for that matter.
It's still November.
And in part of the what we call as gynae examination for the women, there's inclusive of pap smear, at the same time, all right, what we call as a bimanual examination. That means you're assessing the uterus size, and if there's a facility of an ultrasound, to have an ultrasound done. So by doing that, you tend to pick up all these problems. But you correctly pointed out that if there's a fibroid that is small, we don't encourage surgery. You just let it grow for a while. We will just monitor. So probably every 6 months or a year, we will tend to see the patient. Thank
you, doctor, for being on the show with us. It's been a pleasure talking to you.
Yes, I'm sure.